Well, it could be a company softball game, maybe a tennis match with friends. Everybody's at risk for injury when they play sports. And Dr. Kenneth Petersen joins us this morning with what you need to know if you find yourself hurt. And we're just saying that this is the kind of thing that people go out and maybe they don't do it very often, or maybe they do and they get hurt. How can we prevent it from happening in the first place?
Well, you bring up a good point. I mean, some of these players are weekend warriors, right, where they don't do anything during the week, and then all of a sudden, hey, I'm going to go do a pickup game on the weekend. Or it could be youth sports where they're playing every day of the week and then playing games on the weekend. One of the keys is the prevention portion of that. You know, there's been a lot of time and effort spent in the medical field, and especially with sports medicine, to try to prevent those things, from simple stretching.
So you're a proponent of that, of stretching, because sometimes you hear people say, I'm not sure I want to do that or take the time, but you would say it's a helpful thing to do.
Absolutely, and even more so, there's a push to stretch when you are done with your game or done with your practice. Okay. So with that, we probably never stretch enough. You know, probably no sports team probably stretches enough like they should, but stretching afterwards can also help with that as well.
Is there an equipment kind of a part of this equation? Because I think about it with kids especially who are playing, you know, rougher kind of games. And maybe some of the prevention, would it come from making sure you have the right equipment and have things protected that you can protect? It
can be. There's a big push nowadays for basically an injury sports performance programs.
Interesting.
Before they start even playing their sport, or if they're in the off season, where they go through and they work on core strengthening, speed and agility, strengthening even from grade school and up.
Let's talk a little bit about diagnosing an injury, because there are some parents, and when I was a little kid, a lot of parents were just get up, shake it off, keep walking, you know, put some dirt on it, let's go. How do we diagnose how serious something is, or should we be doing any of that diagnosing ourselves on the field?
Well, I think some of it can be. You know, coaches generally either have a sports background where they can kind of get a little bit of an idea what might be going on, or a parent or a friend. But definitely you got to be able to take them to somebody who can be able to diagnose that. Is it a severe sprain, or did they fracture something or blow out their ACL or something like that?
What are you finding? What do people come to you the most with, whether it's a kid or an adult? When you're at work, what are they coming in the door with?
I mean, it's all across the board. It depends on the season. Football season comes, now we see lots of football injuries, everything from concussions to ACLs to any of those things. Weekend warriors are generally more kind of overuse type of injuries sometimes, or they've rolled their ankle or something like that.
So what is the treatment then for any number of these diagnoses? What would we be looking at if somebody did, like, you know, roll their ankle as they're running that they only do once a week or something like that? Right.
Well, some of that's going to be on the severity of the injury. So if they swell a ton, it's probably had more injury than if they just swell and the next day that swelling's pretty well gone. You know, you can definitely go to your family practice doctors. They can do an initial evaluation. Sometimes we need to see them as orthopedic surgeons, because they may have taken out their ACL or something like that, where you need to have surgery for it.
So make sure you're stretching a lot, but if you're going to do that, and in an overall health sense, you want people active. And you want them out there doing this kind of thing. Just take a little prevention and don't take a chance on that.
Yeah, absolutely.
Great information, and if you want more information, you can call 816-380-7662 or visit Cass Regional Orthopedics at their Harrisonville location, and you can learn everything you need to know. Thank you so much.
Thank you.
Learned a lot.